Hello and welcome to a Career in Nursing presentation. I'm going to talk to you today about four different fields. I done the CNA one already this morning and I'll post it later, but the home care assistant, we're going to do the RN, the LVN, and also the practitioner. These are basically career options for you in case you want to go into the field. What I'm doing today is giving you information on some of the experience that I've had, some of the people that I know that have worked in the field, and you can make your own decision. If you're a young lady that's in high school and you're getting ready to enter the work experience part before you graduate, this is especially for you because my aunt, she was a certified nursing assistant. She climbed the ladder, became a medical records librarian. Later on, she became an analytical supervisor for analyzing different types of specialty areas that they needed her to do. And she left as an informatics technician specialist, which is a highly um, praised job at this stage of life right now. So, I'm going to share with you today the job of a home health assistant. Home health assistants, their responsibilities lie basically in the home. They work in the home. When I was trained, um, I was first taught by my aunt, but I believe she mixed up with teaching me in the home, but for a path in the hospital, because you can work in different areas. Home health care assistants, they help patients with personal hygiene, dressing, bathing, and other daily tasks. They perform basic health care services for patients, including checking vitals, signs, and administering prescription medication. They help with general light management of a person's home also. Not always, but sometimes they do. It just depends. Depends on what your assignment and your contract that you're fulfilling. They make transportation arrangements as needed. They work with the nurse, personal care aide, a CNA, nurse aide, nursing assistant, and other caregivers in the home care professional. They observe and report patient condition. They keep up with in-service training. Home health care assistance requirements are a high school diploma, reliable transportation. They must be at least 18 years old, must be able to pass a criminal background check, must be able to provide references, ability to work with limited supervision, ability to follow written and verbal instructions, have a personal and a good physical look about yourself. You must keep yourself well groomed, and you must also be able to do some light housekeeping. You have to do some light because there are times when they're going to ask you. But if you don't want to do it, please share this with your supervisor because you don't have to do it. But share it with your supervisor so she'll know. When you work for an agency, which I can go a little bit in, an agency takes you in once they interview you and check all your background needs. They will ask you during orientation whether you want to work with a particular client. They have a list, and if you went through the real training, like a CNA training or a training for home health care, they usually ask you which ones you prefer to work with. And if they call you and ask you, just tell them, no, I would like to wait on another position. And that way you won't be bombarded with taking care of something that you don't want to do. Also, you won't be going on the job and having a sluggish attitude and taking it out on the patients. Okay? So remember that. So this is basically what a home health care during your training, they will have it all set up for you. I do teach home health care, but I'm not licensed by any type of state. I received my license for CNA and plus for home health care and plus for residential facility administrator. I received all of them in California, but I do not teach. Specifically, if you want to teach, you have to go through them and be accepted through their training programs. And most of the time, you have to have a RN license. They basically want an RN to teach it. I guess they don't feel that people that aren't RNs could teach it, but they can. It just depends on you. So what I've done is I have a class that I teach called Introduction to Home Health Care because I have worked in the field. I have gone through training before. I've had in service trainings before, I've read books before, I've talked to many families that have hired people that have worked for them. So I have like a large area of information to share. That's why I'm doing it today, but I can teach it. And it depends on really who and what state that feels good about letting you teach. That way you can have your own training and then you can have your own prices set of how much, because there's some free training, whether you know it or not, for CNAs, but seeing that the hospitals are going to recognize it, that's another story. Because most states, they recognize the trainers that are within their, training file. Those are the ones. But you can do it. It's just that you have to go through your state. So we're going to move on from home health care and I'm going to go into nurse practitioner. And also I'll go back later and tell you like how um, home health care people are hired because that's important. A lot of people don't even tell people that you can work that way because I met two students in my class and they said they wanted their wives to work in that field, but nobody never, you know, I guess she didn't know and he didn't know. And when he found out, he said that he wanted his wife to work in the field, and I guess she never did. Okay, nurse practitioner job. A nurse practitioner's job includes recording patients' medical histories, performing physical exams, administering diagnostic tests, and creating patient care plans. You will also administer treatment and observe patients functioning over time. To be successful as a nurse practitioner, you should be empathetic about resolute in your decision making and attentive to detail. Ultimately, a top notch nurse practitioner will exhibit cultural competence and exceptional teamwork skills. Nurse practitioner responsibilities are performing physical exams and patient observations, recording patients' medical histories and symptoms, creating patient care plans and contributing to existing ones, ordering, administrating, and analyzing diagnostic tests, monitoring and operating medical equipment, diagnosing health issues, administering medicine and other treatments, detecting change in patients' health and modifying treatment plan as needed, consulting with healthcare professionals and family, training patients and their families to manage and prevent illness and injury. Nurse practitioner requirements, master's degree from an accredited nursing program, an RN licensure in the state where employed or a compact party state and board certified by either the ANCC or the AANP. APN authorization in the state where employed to practice in family health by the Board of Nurse Examiners. Descriptive authorization, experience providing primary care as a family practitioner nurse. Proficiency with medical instruments and equipment required to perform your work. Knowledge of computer based data management programs and information systems, as well as medical records and point of interview technology. a sound understanding of all pertinent federal and state regulations, including HIPAA and OSHA, excellent verbal and written communication skills, knowledge of disease prevention. What I've just told you are the nurse practitioner requirements and the nurse practitioner responsibility and the job of a nurse practitioner. If you decide you want to go into this field, you need to go in the library or go on the internet and type it in, or you can go to the state that you want to work in. You go to their healthcare site, and the healthcare site will tell you exactly what schools are the ones that they suggest and any other information that may be needed. That's for the nurse practitioner. Okay. Now we did the home health care. We also did the nurse practitioner. And I'm going to go back to the interview questions that a nurse practitioner, basically, I'll just give you a few and then we'll go back. Interview questions for acute care nurse practitioner. What made you decide to work with patients who have critical conditions? What has been your most trying experience as a nurse? How did you handle it? Have you ever made the wrong call in an emergency situation? What did you learn from it? How do you cope with stress of dealing with serious cases? Describe a time when you worked as a part of a team to handle a difficult case. Now you will know how it is to feel when you're in a situation with someone else. Okay? So, these are some of the questions that they ask you during a interview. Okay? Some of the answers that you might want to put on there, you might want to go online and look under some health organizations where practitioners have worked. Okay. All right. Now we're going to go into the registered nurse. Registered nurse job. Your duty for caring for the patients coming into your facility include tasks like creating and maintaining accurate patient records, administering medication and monitoring for side effects, recording vital signs, and reporting symptoms and changes in patient conditions. A bachelor's degree in nursing and a state license are essential requirement for consideration. You will also need to be trained in BLS, CPR, and ACLS certified. A professional friendly attitude and effective communication skills are keys to becoming a successful in your field. Registered nurse responsibilities. Maintaining accurate, complete healthcare records and reports. Administering medications to patients and monitoring them for side effects and reactions. Prescribing assistive medical devices and related treatments, recording patient vital signs and medical information, ordering medical diagnostic and clinical tests, monitoring, reporting, and recording symptoms of change in patient condition, administering non-intravenous medication, assessing, implementing, planning, or evaluating patient nursing care plans by working with healthcare team members, modifying patient health and treatment plans as indicated by patient conditions and responses. Registered nurse requirements, a bachelor degree or a master degree in nursing. Pass the National Council licensure examination or the NCLEX, NCLEX-RN. Current state licensure as a registered nurse and BLS certification required. American Heart Association BLS and CPR. ACLS certification. Ability to effectively communicate with patients, families, and physicians and hospital staff. Basic computer skills, professional friendly attitude, Experience in home health care. Nowadays, let me stop here. Before, when I was in training, RNs weren't supposed to do any type of home health care, which is more bedside nursing. They weren't required. But now doctors and RNs have to take some kind of experience or training in home health care. Experience in emergency room or intensive care. I've just concluded by telling you registered nurse requirements, registered nurse responsibilities, and the registered nurse job requirements. Okay, so you have all this information under your belt. So you should be able to go into the field knowing what to expect. And if you need training, what you do is go to the state that you want to work in, or go to a library, or go on the computer and get step by step information on what it takes to be a nurse. Okay, I gave you some interview questions, like, what basically they will ask you if you're trying to become a nurse. And they'll ask you, like, for an RN, they'll say, why do you choose nursing? So you're looking for candidates who love what they do, can tell you why, interested in professional growth. Avoid job seekers who seem directionless or just tell you how much they like the field. If they can't tell you why they love nursing, chances are they actually don't and won't have the work ability to go into the field and stand, have the demands of the position and the ethics to carry it out. How would you respond to a patient who constantly demanded pain medication? The answer to the nurse interview question needs to demonstrate a few attributes. First, you need evidence that the candidate is not going to try to do everything solo. They should call for help if they find themselves in the difficult situation or having a patient insistently demand pain medication. Additionally, you should check vitals, practice safe nursing, and anticipate interventions in the labs when you're in training. You can easily turn this into a behavioral question by asking them to tell you about a time in their nursing career when they had to respond to a situation like this. Keep in mind that some applicants will be new graduates and won't have previous job experience. Don't expect more than what is basically needed. Would you like to be a doctor someday? That might be a question that they might ask you. That comes up a lot because I went to a medical school before for training in the summer. It was for doctors and all the team that you see, that you ever will see in a hospital. That's what the university was offering, a summer program, and I went through it. And most of the times they do ask nurses, do they want to be a doctor? Sometimes nurses and doctors mix like oil and water. It's important to find a candidate who answers the question with a positive attitude towards doctors, but also an appreciation for their own field. You aren't necessarily looking to hire or avoid a candidate who wants to be a doctor someday. On the other hand, you don't want to hear evidence of a definite plan of career growth and dreams about the future. It tells you a lot about their work ethic. There's nothing wrong with hiring someone who wants to move from a nursing position to become a doctor. Just watch out for candidates who seem to go with the flow and don't discuss possibilities for growth. Whatever answer is given, it should show passion and direction. What professional association memberships and affiliations you have, this answer will give the interviewer a much insightful way of learning, like, who and what you do, when you're not working with them. Like if you belong to organizations that specifically work with people that have gone to school for nursing, that will give you like a heads up when you're trying to hire someone. What do you do to stay current with medical findings and practice? That's a good question. You'll always hear that. Watch for someone who expresses an interest in regularly reading journal articles, attending professional conferences, and has a definite system of staying up to date. Great nurses stay informed and put their research into practice with facility approval, of course. And that's so true. All nurses, they have to belong or have some kind of way of staying up to date or going to some type of training so that will help them during their years of working in the field. What interests you about working here? Listen for answers that click with your facility's work culture and ethic. This is a common question for many jobs, but it will tell you a lot. Does the person sound like they enjoy working for your facility? Why? Do you understand the facility, its mission, value, and work that will be expected of them? How do their personal goals and aspirations align with your organization? That's how you really find out if they're a real team player. How do you handle stress on the job? This is a very important question that mostly all employers ask because this will tell them a lot. The vast majority of nurses work 41 to 60 hours per week, and many suffer debilitating musculoskeletal injuries or are concerned about the effects of chronic and acute stress and overwork. Candidates need to be mentally and physically tough with their clear strategies for tackling stress and handling a difficult situation. Perhaps the greatest weakness a nurse can have is not admitting to her stress and having to no way to deal with it. The greatest strength is perhaps then being able to admit when they are stressed out and getting help if they need it. Even candidates who are just out of school and haven't had a previous job in the nursing field should be able to refer to how they handle stressful situations. Additional questions you might hear as a candidate for nursing. Do you have any time management tips other nurses could learn from? What is your most important achievement in your nursing career to date? Looking for a great nurse. Post it up and let others see that you're looking for a specific type of nurse. Now, let me say something about the RN field. I have been around an RN before. My auntie had a colleague that worked in the hospital with her, I went to high school with her, and I got a chance. I mean, she was much older than me and my cousin, but we did get a chance to spend time with her during our early years. She used to take us to like musical events and things like that, and to things pertaining to nursing, like nurse conventions, things like that. Anyway, there's nurses that after they finish going to school and working in the Pacific field, they also switch over and they'll go into other areas like forensic nurse or staff nurse or researcher. I mean, it's endless. A lot of them, they do other things. They don't just stick in one area. So you will see this during your lifetime and you may want to do it. It doesn't matter if you start off from a home health assistant to a CNA like my aunt I explained earlier. She went from a CNA to a medical records librarian, and she became an analyzer for a specific area in the healthcare field, and then she went into informatics, which is a very big area right now in the healthcare field and in other fields. So, I have just given you a briefing on CNA, home health assistant, practitioner, and the RN. The LVN is another area too that you might want to go into. That's the area that I trained in when while I was going on my way to go to a specific nursing program. But every time I tried to go into it, it looked like either the list was crowded or either it was another reason I got another assignment or something. So I basically went from CNA, and one nurse before she was able to retire, she took me on the floor to work at a very nice hospital in California where a lot of professional seniors and politicians and just working class people go when their bodies start to retire. and I learned a lot. And so I had to add all the experience that I had from home health, from agency work, from travel nursing, from acute care. I added it all up, and that was what I went to get my nursing certification for LVN in. But I switched over and became a administrator for a residential facility. Someone let me work after I finished school, and after that, I decided that I wasn't going to work in the field anymore. And presently, I'm trying to write a book, so all the nurses that's coming in, they can hear, some of the experiences I've had. Because a lot of people, before they go in fields, they try to learn. I mean, if you can go into nursing when you get 70 years old, do it. If your body is in that good condition and your mind, do it. Don't let the age or either your naysayers tell you that you can't, because you can. You can do anything you put your heart to. And nursing is such a huge field. You can work in any state. There's so many areas that you can work at. So don't ever give up. Just continue on as far as you can go to be able to work in these fields. So I've given you a lot of information, and hopefully next time I'll be able to talk about the medical assistant and the physical. Um, what do you call it? They call it the physician's assistant, because I went to school with them when they were first starting the program. Is when I went through this summer program. So I'll be able to do those two sometime in 2000. We're in 2021. Happy New Year to everybody listening. Hopefully you have a good year this year while we're in this pandemic in the United States and worldwide. But I'll be able to do it a little bit later on in the year. And I've covered just about everything that you would need to know. And if you want, you can go to the particular state website in your state to learn more, because the more information that you have in any particular field, the better your chances are at becoming proficient in the field. I took my time out today, and I kept saying I was going to do this, but I never did. But I'm going to tell you that this is a very challenging, a very rewarding field. You'll look back like me when you get retired. You can look back and say, oh, this field I worked in, I can share this information with this person or that person. You could be a speaker, for so many schools. You can go in and talk to the students and let them know how well. My trigger for getting in the field was my aunt. She saw me doing little things around the house, and someone in our family became ill. So what she did was took me into her own training, and she taught me a little bit about nursing. So that's how I found out about it. And I worked in the field, and basically that's how I'm making my living off of right now, is from working in nursing. Although I did go into another field, but nursing was one of the really, really rewarding fields that I chose to go in to make it happen for me. Now, if you can go to California, has a website where anybody that wants to go into CNA, LVN, RN, LPN, any of those fields that you would like to work in, you basically can go there and find out about it, because they have the comprehensive um, package there that will give you more information on what you're looking for. So any state you want to work in, basically go there and find out what you want to do. I also want to go into this. If you wanted to do The hemodialysis technician is a very popular field too. One of my uncles was a drill sergeant in the military, and when he retired, he said he wanted to still give back some of his knowledge that he learned, So he became a certified hemodialysis technician. So you can always go in that field too and find out what it is that you need to learn. But I'll do that one on another day too, because this one was basically for nursing. That's basically why I did this. It was just for home health care assistance, and for CNA is a really powerful job. I'm gonna let you know, anybody that's listening out there, that's a very powerful job. Earlier, I did do another presentation. A nurse, she actually wrote a let me say, she wrote a paper on the professionalism of being in the nursing field as a CNA, and I took the time to read it, and I learned so much from it. So I'll try to post the one that I did, so you can hear it. You'll learn a lot from it if you decide that you ever want to become a nurse. It's the professionalism that is needed in the field of nursing. So that way you can keep it with you in your training packet until you become a nurse. It's very good. It's the code of ethics you'll be learning, the behavior that you'll need, the principles that you'll need for communicating with your supervisors, colleagues, doctors, patients, and their family, and your overall behavior working in the healthcare environment is what she's covering. But it's so much information. You'll love it. So, like I say, I'll put it on here later, and that way you'll be able to listen to it. I'm going to do the LVN because I didn't do the LVN training because I was trying to you know, do everything else first, and I left them for last. But a lot of people, they like working as an LVN too. I met a lot of girls that actually went into being a LVN. Like I say, that's when I finished my training. I finished and completed just about everything that was needed for the LVN, but I switched and went into a residential administrator. I took the training and went straight into it because I was already with an agency, and the owner, they put me in one of the schools, which I was so thankful for, because sometimes when you're preparing for your career, you just might not get what you think you should get. And if you don't, you can't give up, because nursing is a field that's worldwide. You will be able to work in this area in any state that you go to. So, LVN is what I'm going to tell you about today. What does an LVN do? An LVN is a licensed vocational or either practical nurse, whichever state you work in. They receive training in basic nursing care. While they cannot practice independently, they are considered a valuable part of the healthcare team. Their typical duties include assisting physicians and RNs with procedures and tests, operating medical equipment, administering and monitoring medication, taking vital signs, and maintaining patient records. They might also assist patients with bathing and dressing and care for infants. Now, it seems like the LVN and the CNA are similar, but as an entry level healthcare position, becoming an LPN or LVN or CNA can open doors to nursing. Both focus on patient care and require a high school diploma and completion of a state approved education program that does end up in a degree. LVNs must pass a licensing exam, but CNAs don't. In general, LPNs earn higher salaries than CNAs. But let's not get it backwards. CNAs earn, it depends on who you work for. They can make up to $22 an hour. When I was coming up, that was an LPN or RN salary. But now it's different. Okay. How long does it take to become an LVN? An LVN certificate program generally takes about a year. You have to complete about 500 to 750 hours of requisite clinical experience depending on your state. Like I said, each state is different. Some states might want this and states might want that. But keep in mind that most states do have a very good program set out. Factors affecting the time frame include full or part-time employment, enrollment, the number of clinical hours required by the school and state, and whether students need to fulfill any general education requirements. What does an LPN do? Working under the supervision of a doctor, an RN performs medical duties. They assess patients' health conditions, including taking vital signs. They report patient status to their supervisor or their RN. They also maintain patients' records, their health records. They listen to and discuss patients' care and concern. They apply and change bandages and insert medical devices like catheters and in some states, IVs, helping patients with bathing and dressing, administer medication if authorized by the state. Basically, as a CNA, I have done it all. I have done everything that they just mentioned here for an LVN. Because when you do private duty nursing, you get a chance to administer medication to them. Now, it depends, like they say, on your state, because some states don't allow you to administer medication. They have what they call, you're going to do what they call is observe them take their medicine. That keeps you from being penalized if a legal issue should ensue. Okay, so there's a difference. You can either observe them or either you can actually give it to them. I've given them medication because the agency that hires you or the company that hires you, they're responsible for training you. Now, the reason why I think they do that is because most of the medications that the people are on are not, to me, on your duty, they're not as vast as what a RN has taken when she's gone to school. Because I did take a pharmacology class, but I ended up leaving because I wanted to pursue something else. I took a nutrition class, I believe. That's why I left. See, one thing about life, let me just stop and tell you this. You can do anything you want to. Even if you want to be an LVN, but you don't want to finish the program, you want to learn some things that an LVN do. The thing that you have to ask yourself is, am I good at this? Am I going to want to go to work every day? The different presentation that I just gave you just at the beginning, it answers some of the questions or some of the answers I'm trying to tell you right now. If you feel like, oh, I'm better at maintaining a person's health records, I'm honest person, I'm a detailed person, then maybe you just want to go to school and be an LVN to learn what it takes to maintain that type of trust in maintaining a person's records and keeping their information private. So if you do feel like some of the things as an LVN that you like, but you want to put them with another job, you can do that. But it's like when you go to the interview, like what I told you earlier, I did this on purpose because when a person is trying to hire you, the questions that you telling them is going to let them know, oh, I'm just coming here to get a paycheck, or I'm just coming here to get away from a situation. They know that. That's why they ask you the questions. And if you really listened to me earlier, I did that on purpose. I didn't just come here to say, oh, like I'm reading to you now and giving you advice of what I've done with my life and other nurses I work with. I'm telling you what it is like and what you're going to expect And then I'm giving you the state requirements on what it takes to be an LPN or an LVN or an RN or a practitioner or a CNA or a certified home health. I did it, told you everything, but I gave you the interview questions because they can tell. Say like you go in there and I went to replace a nurse one time because they said after she finished school, she didn't really want to. She found out the day of the job that she had to work. She said, "This is not for me." After she went through all, it happens. That's life. And this is why they train so many girls and males during the year at all these schools because there's always going to be somebody that's going to be able to take care of a patient and restore their health back to them. So I'm just giving you the different information that, a person needs, to become an LVN. And the work setting, according to the BLS, nearly 40% of LVNs work in nursing and residential care facilities. The remainder find employment in hospitals, physician offices, home health care services, and government agencies. Those are the places that basically they work. I think I've covered it all because when I was coming up, they made it seem like all LVNs only worked in convalescent hospitals. They do not. They work in a variety of places, which I just read. Let me read it again. Most work in nursing and residential care facilities. They still do. But the remainder find employment in hospitals, physician offices, home health care services, and government agencies. Successful LVNs and LPNs, they possess empathy, compassion, and patience. They also need physical and mental stamina as the job mandates hours of standing, walking, lifting, and bending. Other important qualities include interpersonal skills, effective listening and speaking, the ability to handle stressful situations, and attention to detail. So you ask yourself, how to become an LPN? LPNs and LVNs must complete a state nursing program approved by a program in your state, and it leads to a certificate or a diploma. Most students finish the program offered at a community college or technical school in about 1 year. The typical LVN curriculum includes anatomy, biology, chemistry, psychology, and nutrition. Students also gain knowledge and skills in emergency medical technology, first aid, and nutrition. LPN, LVN programs prepare graduates to pass the National Council Licensure Examination in Practical Nursing, commonly known as the NCLEX-PM, which states require for licensing. In addition, LPN, LVNs can earn postgraduate specialty certificates in areas like IV therapy, long-term care, and pharmacology. The National Association for Practical Nurse Education Service offers several certification options which can increase earning potential, job prospects, and opportunities to work in an area of interest. LPNs and LVNs must hold licenses from their state nursing board to practice as detailed below. Licensing requirements for LPNs or LVNs. State boards issue LVN licenses which must be obtained prior to beginning work. Eligible applicants need to show completion of a state approved educational program. Candidates may be asked to submit fingerprints for a background check along with references. LVN, LPN renew every few years depending on specific state requirements. While each state imposes its own licensing requirements and possesses all processing, all administer the NCLEXPN examination, which test takers must pass to earn their licenses. Their primary multiple choice questions cover safe and effective care, health promotion and maintenance, psychosocial integrity, and physiological integrity. The other type of state administered exam is the NCLEX-RN, which applicants must pass to become registered nurses. The LPN, LVN often work for a couple of years before continuing their education to become an RN. The majority of U.S. states have implemented or are in the process of implementing Nurse Licensure Compact, NLC, which allows LPNs and LVNs and other healthcare providers to practice in any L, NLC state under a multi state license. That's good. That wasn't there when I was in training. Benefits include telehealth and online nursing education, facilitation, the ability to cross borders to assist during disasters or crises, and the elimination of separate and costly license procedures. Isn't that the truth? It's just like transcripts. Every single time you go and apply for a teaching job or any other job, they always want you to get that. So now they're passing a law where you can use it in multi states. That's super. Okay, LVN salary and job outlook. According to the BLS, LPNs and LVNs earn a median salary of $47,000 and 480 with a fast average projected job growth through 2028. The expected growth stems from the aging baby boomer population and the prevalence of chronic conditions like diabetes and obesity. The top industries reflect these trends, showing 13% of LVNs work at a skilled nursing facilities, with the remainder in physical healthcare services or either physician offices and home care and retirement communities or assisted living. Job prospects expect to increase for LVNs in rural and medically underserved areas and for those with certification in gerontology and IV therapy. Texas, California, and New York employ the highest number of LVNs. Did you know that? Yes, they do. They employ the highest number of LVNs, which is very good to know. Um, I wanted to give you a little bit more information, and then I'm going to end because I have another program for my K through 12 class. I also teach K through 12. I used to be a K through 12 teacher also. So by my being retired now, I just took my time to come in, just like the RNs and LVNs. We all have different areas we go into, but I was a teacher too. So what I'm doing is teaching the youngsters right now and I'm actually teaching nursing too, but I'm doing introduction because I'm not assigned to any type of state to work and teach LVN or RN. Excuse me, not RN, LVN or CHHA and CNA. Okay, career advancements for LVNs. LVNs expect numerous career opportunities, including focusing on elderly physician office and private medical and surgical hospitals and mental health and general nursing care facilities and in-home healthcare facilities. Another common path to career advancement consisting of earning a degree that prepares graduates to apply for their RN license. Many LVNs enter LPN to RN or LPN to BSN programs, both of which allow advancement to careers as RNs. Students in LPN and RN programs acquire the skills and earn the credentials needed to take LVN exam. These programs prepare professionals to become registered RNs with more responsibility and potentially higher wages. LVN to BSN bridge programs also prepare students to the NCLEX RN exam, but culminate in a bachelor's degree in nursing or a BSN opens doors to more opportunity, pay, advanced practice, education programs, and careers. Flexible online options allow nurses to continue working while completing their degree. I want to start right there. My teacher, she told us that she worked as a ICU nurse and neonatal nurse, and she also became a teacher because I was able to go to her class because I had to go to training twice to get my CNA, and I took a lapse so I can go and help my family out. So I went back, and she was so gracious in letting all types of students from all types of life come into her class. When we graduated, it was so many different types of people from all over the world in her class. A lot of them were divorcees, some of them were leaving countries where they were from. Like, for instance, with me, I had to help family, our Chelsea whole family. So I didn't get a chance to continue working in nursing because I had received my nursing a while back. And then I took her class in the 2000s. And she was so happy to have all the people coming there. And even if you came in there at 7 o'clock, I mean, in the morning, earlier than class, she allowed you to come in. And class didn't really start. And she had two. One started at 9 and one started at 2 o'clock in the afternoon. So I went to the afternoon one because I had to go to school earlier. And like I said, I had to help my relative. We had one lady in the class, she had took care of a relative for 20 years that had Alzheimer's. And she was taking the class so she can get her CNA license. So these are some very good fields. That's why I tell every girl, just like my auntie told me, because I never thought that I would work in this field. But she took me and showed me first. And then her colleague was an RN and she worked in the clinic, and she took me in the clinic in California to see what it was like to work in a clinic. And from there, I took my training at a training hospital in California. And from there, my first job was working in a private residence for a family, and their sister. They all lived in the same place, but was taking care of the sister. And from there, I went on into doing agency work, and then I started doing travel nursing, just traveling between California and a neighboring area. I didn't go too far, because I didn't want to be places I wasn't familiar with. But other things that I've done, I wanted to share with you today is that my first job was in a private home. And then from there, I also worked for ARC. If you don't know what ARC is, they changed their name, but they're an organization that catered to people that are born into our world with some type of medical, some type of health crises. And so I worked for them to get more information. It was rewarding, so rewarding. Most of the families can't even take care of the people that they brought to the earth. So they have an organization that basically have homes that they stay in, and they hire professional people like, yourself, if you go into the field, or myself when we work. And I think from there, I worked in a children's center too. These children's centers are where kids are kept when the parents can no longer parent them, or it could be for a small moment in their life, an interruption in their life that your child might have to stay there. I've worked there before. I've also worked in assisted living facilities. I've worked in there. I've worked in the private homes, high rises, private houses, um, corporate. I worked one time, this was unusual. I worked for a corporate business once where people, they just don't want to live. They could still take care of themselves, but they don't want to live like by themselves in their home. So they built this huge complex where everybody has their own room. It looks like a hotel, but not as well. I'll say it looks like a hotel. It's just not a real fancy one, but a hotel, and they all stay in like they little high-rise rooms, real nice, well-kept rooms. Uh-huh. And if they don't want to eat downstairs in the cafeteria, they eat in their room. And I said, oh, this must be nice once you get, a certain age and you don't want to work. Because I'm at the age right now where I'm still considered a middle-aged woman, an early middle-aged woman, and I look at a lot of the people now that's living until they get in their 70s and their 80s and their late 90s. I'm going like, oh my God, do I want to live? I went to a college before when I was taking a health science, and the teacher, one of the assignments she gave us, she asked us to put where do we want to be between the age of 20, because I was in my 20s, all the way up until you get where you can't do for yourself anymore. And I think my chart had it only went up to 100, but I didn't even put my little arrow to fit the area going into anything past 80 because I said I really don't know, if my health is going to be that good at that age. I think I would rather just go on and leave. I don't want to be around because some people they're not treated well when they get older. I didn't have the experience of seeing that, but I have watched some videos. Because oh yeah, I forgot to mention that some of the things that I have, training that I've had, I also went to a training that was funded by the United States. Uh, Attorney's office where they had nothing but cases on people that have been abused by people or more likely by a facility. So I had training in that area too to put on my resume for my, experience in nursing. But there's so much you can do in this field. You can go anywhere you want. You don't have to just work in one stay in one state unless you want to. Something like the lady I was telling in the other tape. It was two girls I worked with. One was from Northern Europe, but she came to America and she came to CNN. But before I left, she told me that she was taking the test to become a surgical technician. So she worked right there, hand in hand with the surgical doctor. And the other one, she didn't get a chance to really tell me, but I believe she was happy where she was. She worked in the surgery and she used to go in and out of different rooms and do whatever it is she had to do on a daily basis. And she seemed so like she loved her job. So it was so rewarding for her. And she had already been there 15 years. So it depends on the person, what you want to do with your life and where you want to go. You know. But I decided to do the nursing program today because it's always something since I've been out of the nursing profession and the teaching, working for district and private sector schools and charter schools, I always said that I wanted to go back and, give back to the community and give them experience that I had because you never know who's listening and who might want to go into this field. So that's why I took the time to, you know, do this live show. And I'm hoping that people got something out of it. If you're not here, one thing I notice about, because I'm new to this, I have a lot of information my family told me to that I can give people, but some people they don't stop by because I guess they don't see it, or maybe it's not advertised right where they can do it. But if you get a chance to come back and listen to this tape, just listen to the requirements of all the areas I touch bases on: CNA, CHHA, practitioner, RN, and the LVN. I touched on all of them. And next time, hopefully, when I do this type of thing, I'll be able to do the medical doctor too, because I went to school, a summer program for everybody that you see that work in a hospital, all the allied health care, and the medical doctors. I went to two universities during uh, a certain time, and we were taught what it takes to go to medical school. And don't think that everybody that goes to medical school has to be a doctor. There's some other areas for people to work in too. But matter of fact, I think I'm going to do that. That's going to be my next choice, is to do physician assistant, the medical doctor, and hemodialysis technician, because one of my relatives worked in that field, and I already covered the RN because I had a relative that worked in that field. I'm signing off, and I thank you so much for coming here today, and have a happy new year.